Have you ever seen someone lose their memory, and no one knew why? I have. After 25 years working with older adults, I can tell you this: sometimes it's not aging, it's something hiding in plain sight. A 68-year-old woman, sharp, independent, never forgot anything, started getting lost driving home. Her family feared Alzheimer's. But they were wrong. The real cause? Her medications. And within months of fixing them, her memory came back. Now here's the uncomfortable truth: this is happening to millions of seniors right now, silently. And today, I'm going to show you exactly what might be stealing your memory. But stay with me, because the number one cause isn't a single drug, it's something far more dangerous. Let's start. First, those harmless sleep aids. If you've ever taken something like nighttime allergy or PM pain relief, you need to hear this. Many of them contain a chemical that blocks acetylcholine, the very thing your brain uses to form memories. When you're over 60, your brain already has less of it. So what happens when you block more? Brain fog, confusion, memory gaps. And here's the scary part: you might be taking it every night without realizing it. Now let's go deeper. Acid reflux medications, some of the most commonly used drugs in America. They seem harmless. But long-term use can quietly drain your vitamin B12, something your brain desperately needs to function. Low B12 can mimic dementia so closely, even doctors sometimes confuse the two. And studies have linked long-term use to a significantly higher risk of cognitive decline. But it doesn't stop there. Bladder control medications. These are often given without warning, yet they directly interfere with memory pathways in the brain. We're not talking about mild effects. We're talking about actual shrinkage in memory-related brain areas. Think about that for a second. Now here's where things get even more serious. Anti-anxiety and sleep medications, especially long-term use. They calm your brain in the short term. But over time, they slow down your brain's ability to adapt, learn, and form new memories. And once you start, stopping becomes extremely difficult. So the cycle continues. Now let me be clear, not every medication is bad. Some save lives. Take cholesterol drugs, for example. They protect your heart. But your brain also needs cholesterol to function properly. Lower it too much, and communication between brain cells can suffer. That's when people start noticing mental fog. Here's something most people never realize: some older medications used for sleep, pain, or mood are among the strongest memory disruptors. Not instantly, but slowly, quietly, over years. You don't notice it at first. You just feel off, and you assume it's aging. But it might not be. Now this next one is critical, especially if you have a loved one in care. Some powerful psychiatric medications are being used in seniors, not always for the right reasons. They suppress brain activity. They reduce alertness. And they can accelerate cognitive decline. This is happening more often than people think. And most families never question it. Now here's something even more surprising. Not all antidepressants are equal. Some are relatively safe for the brain. But one specific type acts very differently. It interferes with memory-related chemistry in a way others don't. And it's still commonly prescribed. Now, here's the most important part of this entire video. Because everything we just talked about, it gets worse when combined. Most seniors aren't taking one medication. They're taking 4, 6, sometimes 10. And when multiple drugs affect memory at the same time, they don't just add up. They multiply. That's called medication overload. And studies show it can more than double the risk of dementia. Let that sink in. Double. But here's the good news, and this is where it changes everything. This type of memory loss is often reversible. Yes, reversible. When the right changes are made under medical guidance, the brain can recover. Clarity can return. And people can feel like themselves again. So here's what you need to do starting today. Write down everything you take. Every pill. Every supplement. Even occasional ones. Then talk to your doctor, not to stop everything, but to review what's truly necessary. Imagine the power in that question. Your memory is essential to who you are. Understanding how medications may influence it can open doors to greater awareness and improved choices for a healthier future. By asking about your memory, you empower yourself. This journey towards reclaiming your cognitive health starts with curiosity. Challenge the norm for clarity. Discover how what you consume affects wellness and memory. Knowledge empowers your brain's vitality.